I told in the picture number 1, showing the normal abdominal aorta, the abdominal aorta continues from the thoracic aorta, and thoracic aorta is the part of arch of aorta, what is origin from the heart. But the abdominal aorta normally look like this. This is the artery. Artery has a wall. The arterial abdominal aorta artery has a 3 layers. But if the patient has any kind of weakness on the wall of the artery will be dilated, look like this. This is called dilated artery. Why this is dilated? Because this is the structural deformity, or the during the blood supply, because of the wall is weak, when blood is transmit, they are bulging to the outside because the wall is weak. If wall is weak, the chance of rupture, if abdominal aorta, especially aneurysm, is rupturing, this is life-threatening condition. So this one is called aneurysm. Aneurysm means dilatation of the artery or damaged aortic wall. If you ask me why it is dilated, because the wall of the artery is not strength enough to make or patency, to keep its patency. When blood is passing, because of the weakness, they are dilated or bulging to the outside and chance of tearing, right? This type of defect is called abdominal aortic aneurysm. NCLEX board asks, if your patient has to need to follow the physical assessment on the abdomen, as I told you, physical assessment of thoracic area or any other, the basic steps we have to follow: inspection first. Inspection means we have to watch, we have to observe the abdominal area or the thorax, I mean respiratory lungs area. Like abdominal assessment, we have to check the shape of the abdomen, the hair pattern in the abdomen, any kind of birthmark, any kind of abnormalities like tumor or any kind of mass, right? Any kind of blood clotting, ecchymosis, hemorrhage, hematoma. If we see, we have to write down, keep a documentation. After inspection, for any other system assessment, we have to palpation. First palpation is the superficial, then we go for deep palpation. After that, we have to use the border area of the hand, and then percussion. And also last one, we use the stethoscope, right? And we listening the sound. If we do assessment the lungs, we has to put the diaphragm, the stethoscope, and we can hear the normal lung sound. Like if we put the stethoscope over the trachea, we should hear the bronchial sound. If we put the diaphragm of the stethoscope, the center of the lungs, we can get the vesicular sound. If we put the diaphragm in the periphery of the lungs, we could get the bronchovesicular sound. Like if your patient has a bronchial asthma, if you put the stethoscope during the auscultation, we has to get the wheezing, right? If your patient has any other problem, maybe we can get the stridor or rhonchi. It depends upon what are the underlying pathology. When we put the stethoscope on the abdomen, we have to try to listen the bowel sound. Just it is the just up and little bit right to the midline of umbilicus bowel sound. But my question is come here. In case of abdomen assessment, we do not follow the regular step-by-step process. We have to follow inspect first, then go directly number 4, auscultation, then go percussion, and finally palpation. If you ask me why, answer is if patient has any kind of tumor or aneurysm, when you do palpate means you pressure, patient feel pain will be more. When patient will be feel pain, you will not examine rest of the system because patient is irritable. You will not get accurate measurement. Also, most important here, what NCLEX board asks the question. In case of aortic aneurysm, we never ever palpate the patient. So question come, if your patient has an abdominal aneurysm, which steps you never perform? Palpation, never ever perform. Also, I want to tell you, NCLEX board sometimes asks, in case of abdominal assessment, what are the step-by-step procedure we have to follow? So another question sometimes NCLEX board asks, in case of renal tumor, it is called Wilms tumor, we never ever palpate the abdomen, right? One, I said, in case of aortic aneurysm, we never ever palpate the abdomen. Another question come in case of Wilms tumor. This Wilms tumor is a tumor in the children. It is called kidney tumor, right? In case of Wilms tumor, we never ever palpate. Okay. So